Are Border Collies prone to hip dysplasia? Hip dysplasia is a common health issue that affects many dog breeds. It is a condition in which the hip joint does not develop properly, leading to joint instability and eventually causing arthritis. Border Collies are known for their intelligence and athleticism, but are they also prone to hip dysplasia? In this article, we will explore the prevalence of hip dysplasia in Border Collies and how pet owners can prevent or manage this condition. Prevalence of hip dysplasia in Border Collies. Hip dysplasia is a hereditary condition, meaning it is passed down through generations. According to several studies and health surveys, Border Collies are indeed prone to hip dysplasia. However, the prevalence varies among different countries and breeding lines. In Australia, a study conducted by the University of Sydney found that 18% of Border Collies were affected by hip dysplasia. Another study in the UK showed that the prevalence of hip dysplasia in Border Collies was 57%. These numbers indicate that Border Collies have a higher risk compared to some other dog breeds. Causes and factors. Hip dysplasia is a complex condition that can be influenced by both genetic and environmental factors. In Border Collies, genetics play a significant role in the development of hip dysplasia. However, other factors such as obesity, rapid growth, poor nutrition, and excessive exercise can also contribute to the occurrence of this condition. Symptoms and diagnosis. The symptoms of hip dysplasia can vary from mild to severe. Dogs with hip dysplasia may show signs of lameness, difficulty in getting up or lying down, reluctance to climb stairs or jump, and decreased activity levels. However, these symptoms can also be present in other conditions, so it is essential to consult a veterinarian for an accurate diagnosis. The diagnosis of hip dysplasia is typically confirmed through a physical examination, X-rays, and sometimes additional tests such as CT scans or MRI. X-rays are the most commonly used method to assess the hip joint's condition and identify any abnormalities. Prevention and management. While hip dysplasia cannot be completely prevented, there are steps that pet owners can take to reduce the risk or alleviate the impact of this condition. Here are some preventive measures and management strategies. 1. Breeding selection. Responsible breeders should screen their breeding dogs for hip dysplasia. The Orthopedic Foundation for Animals, OFA, offers a hip dysplasia screening program. Potential breeding dogs should have their hips evaluated and certified by the OFA or other similar organizations. 2. Exercise and weight management. Border Collies are energetic dogs that require regular exercise. However, excessive exercise during the growth phase can put stress on the developing joints. Pet owners should provide appropriate exercise while avoiding activities that can strain the hip joints. Moreover, maintaining an ideal weight through a balanced diet is crucial in reducing the impact of hip dysplasia. 3. Dietary supplements and medications. Certain dietary supplements such as glucosamine and chondroitin sulfate have shown to support joint health and alleviate symptoms of hip dysplasia. Additionally, medications and pain management techniques prescribed by veterinarians can help improve the quality of life for dogs with this condition. For physiotherapy and rehabilitation, physical therapy techniques such as hydrotherapy, therapeutic exercise, and massage can be beneficial for dogs with hip dysplasia. These therapies can help strengthen the muscles around the hip joint, improve mobility, and reduce pain. Conclusion. In conclusion, Border Collies are prone to hip dysplasia, but the prevalence varies among different populations. Responsible breeding practices, regular exercise, weight management, and appropriate veterinary care can play a significant role in preventing or managing this condition. Early detection and intervention are crucial for improving the quality of life for affected dogs. If you own a Border Collie or are considering getting one, it is essential to be aware of the potential risks associated with hip dysplasia and take the necessary steps to minimize its impact on your pet's health.